So when I proceed, I'll do a very short recap of what we covered yesterday, and then we'll just proceed. Or rather, let me hear from you guys. What were your pickup points? Which conditions did we cover yesterday, and what are some of the things you picked? And I will just pick as at random so that I just get what we learned. Let me start with no, Joy Sharel was not there. Let me start with Jen Bitange. What were your pickup lines for yesterday class?
Yeah, I remember we talked about which is a bronchial. Yeah, about we discovered that it's a bronchial obstruction, and it may occur in children and adults. And the signs were cough, I think that is some of the things I gathered yesterday.
Great. You are indeed keen. What about Jane Ogano?
Oh, hello.
Yes, we can hear you.
Okay, what I can remember, signs of respiratory diseases. I learned that you can tell what one is suffering from by the color of the sputum. Hapo ndio nikajua kuna zingine zinakuwa greenish, zingine yellowish, zingine dark brown na kadhalika. So the thickness and the color will determine what you are suffering from. May indicate. Yeah.
Thank you so much. So, which color indicate an infection? I think I mentioned it. Which color indicate an infection?
I think it was yellow, if I'm not wrong.
Yeah, sure, you are right. Of course, rusty yellow and sometimes brownish can indicate infections, but different, of course, different types of infection. Let me hear from Brenda Luvai. Anything you picked from yesterday's class that has not been mentioned?
That asthma is treatable.
Yes.
That was one of my takeaways, and the causes of pneumonia can be bacterial, it can be viral.
Great.
Yeah.
Thanks. And we were very specific. We say that pneumonia is caused by streptococcus, pneumoniae, and also other viruses and fungi. And we say that, coughs with phlegms or sputum, and someone experiencing pneumonia will have chills, fever, chest pains, what else did they say? Fatigue, and all that. So today I will major on the treatment of these diseases. Please kindly, if you have a question along the way, just put it in the chat box, or just feel free to stop me and ask the question if it's a burning one. So I want to pray once again, then we start. Our Father and our God in heaven, we invoke your presence to abide with us even as we continue this class, that we may fully learn from the school of Christ. Is my prayer in Jesus' name. Amen.
Amen.
Amen. So, I will not talk again about the conditions we talked about yesterday, but I will talk about their treatment. So today we want to just appreciate the common conditions, natural support in terms of herbs and some of the remedies that can be used to bring about healing. We'll talk about lifestyle foundations of healing, and when you talk about lifestyle foundation, this is purely new start, nothing more, nothing less. Actually, um, everything is coded in new start. And so before you ask someone whether they have taken herbs or what, the question is, have they actually rested? Are they taking enough water? What about trust in God? What about like this is a full coded uh, remedy, without which, or with uh, an abuse of just a jot of it, uh, disease will surely come. Then we have critical conditions. There are critical conditions which we'll talk about today. I mean, some of the precautions that should be taken, some of the misconceptions that have been, and also how to generally manage, and the limits that we have as medical missionaries. Remember, we are not doctors, and so we are limited in a way with the government regulations, and also we are limited in terms of knowledge. I mean, I'm not doubting the power of God, but I'm trying to say that there's a difference between you and someone who has gone to school for 6 years. So we are starting with we talked about pneumonia, and we said that the main cause of pneumonia is a bacteria called Streptococcus pneumoniae, and also we have other virals and fungal infections. We had talked about this, so I'll not really dwell much on this. Today, I want us to start from bronchitis. Bronchitis is the inflammation of the bronchus. Inflammation ni kufura. There is, by the way, one of the things that causes inflammation is accumulation of blood. Tuseme sahii umekatwa na kitu ama umeanguka, and there will be inflammation. Sorry for the background noise. Let me set it out. Um, Someone in the background. It's okay. I am in a quite noisy environment, so you'll just bear with me. I was saying some of the causes of inflammation is of blood, accumulation of blood in specific regions. And when I say this, why can't I record? Not sure why don't just a minute. I realized I didn't start my recording. Oh, okay. Mhm. Allow this time. Okay, grant access granted successfully. Just a minute. I get this right so that we can proceed. Desktop. Then you start recording. Oh my God. Great. I think we can now proceed. Proceed. Which window? Meet. Very nice. Nice. So we can proceed. Now, so I was saying that there there are other causes of inflammation. Of course, I've talked about blood, accumulating or blood clotting in a given area. This can cause inflammation. I also talked about bacterial infections and any other infection, any other antimicrobial, infection, that is viral, fungal, or bacteria. And so when we talk about bronchitis majorly is the major causes of bronchitis is either viral or bacterial infections. And of course, we have others like smoking. We have exposure to chemicals and dust, which eventually can cause inflammation. And this is actually bringing about narrowing of the diameter of the bronchus, or of the bronchi. You can compare this first picture with the second one, so that the second one has a thick mucus, lining. And bronchitis present with increased amount of mucus in the lining, and this actually brings about obstruction in the airways. So if you ask me what bronchitis is, I will tell you this is a viral or a bacterial infection that is caused by either, uh, of course, uh, including the, well, in the bronchus, ama in the lungs, majorly akunanga normal flora, by the way. There's no normal flora. So any virus or bacteria that can cause inflammation to the bronchus can cause bronchitis. Sasa kuna two types of bronchitis. Kuna acute bronchitis, bronchitis that suddenly occur, and it takes some time, some few days to weeks to be cleared off. But again, we also have chronic bronchitis. Chronic takes about 3 months and above. I mean, its manifestation lasts a little bit longer. And so, ukienda hospitali utapewa antibiotics if it's a bacteria. Wengine watapewa bronchodilators, zile watu wa asthma wanapewa, na wengine watapewa steroids. Steroids will actually help you just soothe and prevent excessive, frictions and such. But you realize that these ones may be a perfect treatment for bronchitis. But again, what are some of the side effects for this medicine? I'm trying to say that medicine given in hospital can fully treat bronchitis. But there are medicine which will not fully treat. For example, if you're given bronchodilators, they will just act for a short time, and then eventually this person will go back to the normal, routine. Think about antibiotics. Antibiotics will work because they are targeted to kill bacteria. But we also have the natural sources of antibiotics. The problem of antibiotics is that they have side effects, which include liver, kidney damages. We have the pancreas, we have the GIT and all that. And so, have you counted the cost of the type of treatment method you are subscribing to? And I will tell you that there are some types of respiratory diseases that you will just need to seek medical attention. A good example is tuberculosis, because it can kill you within days. It can kill you within days. So that is bronchitis. That is bronchitis. I will talk about the treatment of bronchitis when be talking about a general respiratory detox. I'll give you a formula today that can be used for almost every condition of the respiratory system. And so we have chronic bronchitis, wengine wanaita COPD. COPD. And so when you talk about COPD, this is just chronic obstructive pulmonary disease. It is basically the obstruction of the airways. And chronic means like it has taken more than 3 months. It's prolonged in a way. So if you look at these slides, you look at the alveoli. Compare this type of alveoli and this one, or rather this one and this one. You'll evidently see that for one, it's kind of narrowed. The other one, the one which is narrowed, is actually inflamed at the same time. So this is what is called chronic obstructive pulmonary disease, very closely related to chronic bronchitis. So that is it. Yes, let's proceed. Ikifika 9, mtu anikumbushe so that I stop the recording and start again. Now, let's proceed. We had talked about asthma yesterday, and we say that asthma is generally a chronic inflammation of the airways, which are majorly triggered by asthma, which are majorly triggered by infections and allergens. That was the definition I gave. I'm trying also to make this thing simpler so that we can all understand. So a chronic means it takes some time. Inflammation of the airways, which is triggered by allergens and infections. Sometimes maybe exercise and all that, but that is not very, very common. And we said that the major complications for asthma is that someone will present with wheezing sound, shortness of breath. What else did we say? Regular coughs, and especially at night. What asthma on a cough sana at night, just because of the orientation of the body at that time. At that time, the body majorly is not in an upright position, and so unapata kwamba there's an obstruction, the physical obstruction of the airways. And so for treatment, ukienda hospitali utapewa bronchodilators, like the one you can see here. This is a bronchodilator. Itafungua the pathways just for some time, and then it will be able to give you present relief, and then you will of course depend on it in the entire lifestyle. Then tunapewa corticosteroids. Of course, corticosteroids will try to do away with excess mucus and also just smooth them, na vitu kama hizo. Um, but now there's more into this than what we can actually be given. Um, Another critical condition is tuberculosis. When you talk about TB, you are talking about a very critical condition caused by a bacteria called Mycobacterium tuberculosis. This is a bacterial infection. And someone having TB, they will not lack these three signs. Number one is that they will have chronic coughs. Chronic coughs. Na hizi coughs ikikaa for more than 1 week inaweza kuwa blood stained. The cough may come with some blood stains pattern. I mean, ni kama damu iko kwa cough, iko kwa sputum, sorry. And then one of the clear indicators of TB is that these people will start losing weight. I am sorry, some of my
Teacher, your slides are stagnant.
slides are stagnant. Oh my god. Sorry. Mhm. But you guys didn't tell me. I've seriously moved. Okay, nice. So let me share again. Yeah, there. What about now? Are they moving? Are
Yes,
they moving or they're still stagnant?
they are
No, they are
moving.
moving.
Great. Well, guy. So I had talked about pneumonia. Kidogo tu, this is just a recap. Then I talked about bronchitis. Then nikaongelea chronic bronchitis, that is COPD, chronic obstructive pulmonary disease. Then we've talked about asthma, and we are now talking about TB. So that is where we are. Was everything clear without the slides, so that I know whether to proceed or what I decide on what to do? Is everything clear?
Yes.
Kind of.
Great. Because most part of this is just nataka mshike hizi vitu, ndio maana nazirudia hivi. So I was talking about TB, which is caused by Mycobacterium tuberculosis. That is the name of the bacteria. And majorly, TB has 3 common symptoms which we will never lack. Number 1, nimesema kwamba watu watakuwa na chronic coughs, na hizi coughs zinaweza kuwa blood stained, zinaweza kuja na blood stain sputum. Number 2, nimesema wenye wako na TB kama wote, they will experience weight loss within a very short day, a very short lifespan. Then they will have chronic chronic what? Chronic night sweat. This is something that never lacks for this patient. And then, of course, this may present with chills and definitely chest pain will come. Kuna mtu kuna mtu haja mute. Kindly mute your microphones. Because I'm recording, kindly mute your microphones. Now, kuna, well, in the hospital setting, we give this long-term multi-drug regimen that is always given. Batiana, someone kindly mute their microphone because I am recording. Kindly mute your microphones.
It is Samuel Maina. You can mute.
Samuel,
You can mute.
mute. Samuel, kindly mute. You know, I'm not the host of this meeting, so I can't mute. Someone can just on. Thank you.
Ruth Karanja, mute.
Nice. Great. Asante. Nice. So, nilikuwa nasema, in the treatment of tuberculosis in the hospital setting, we always give what is called a long-term multi-drug regimen. Hiyo nakwanga na drugs kama can I really remember them? I can remember rifampicin na isoniazid, but kuna around 5 there. Now, we'll talk about the treatment of TB in a few. We'll talk about the treatment of TB. And so, what are some of the special consideration for the treatment? We are now getting into the treatment. You know, children can have these conditions, and you really don't. You really, of course, sometimes you may just see the clinical presentation and you're able to see and act, but sometimes it's not even possible. So there are specific viruses that are very common to children. An example is called RSV. RSV is rhesus syncytial virus. Well, I don't remember the spelling very well, but it's a very common virus for the children, and this one can cause what is called bronchiolitis. Of course, nothing. It's not very much different from COPD, and then at some point, the immediate treatment that we are going to give to such individuals is in the law of first aid. In the law of first aid, there's something called, let me just write it. In the law of first aid, there's something called ABCD. Just write this somewhere. You have A, B, C, D. ABCD. ABCD, A stands for airways, B stands for breathing, C stands for circulation, and D stands for danger. A stands for airways, B stands for breathing, C stands for circulation, and D stands for danger. Now, danger. Now, for anyone having any problem with the respiratory system, ABCD is very important. I mean, there's no way you will go for eucalyptus oil if these people are not breathing. I mean, you will not be making any sense at all. And so airways must be fully open, like fully managed. You know, you will encounter conditions like someone has fainted, ama mtu ana struggle sana to breathe. And so in such cases, first things first, you will use even methods like cardiopulmonary resuscitation. You can write this and then you go and research. Let me just share a picture of the same. CPR, CPR, inaitwa cardiopulmonary resuscitation. This is uh, this is done to increase the breathing rate of such patients. Let me just share my screen so that you're able to. I believe you can see. Um, Let me just ask, who has ever done this? Who has ever done this? This is CPR. Nani ashaifanya hii? Well, how many have no idea what CPR is? Cardiopulmonary resuscitation. Just carry up your hands. Hapo kwa icon kuna place ya carry up your hand kama hiyo. So just carry up your hand if you have no idea. Because if you don't carry up your hand, I think I will will ask you questions. Sasa ni Joel peke Redemptor peke yake ndio hajaisikia. Now I want you guys to explain. Then this should be a very easy thing. By the way, this is a very easy thing. Let me get someone to explain to us how this is done. Just in your own words. In other words, I'm trying to say, explain what is on the screen. Yes, anyone? I want a volunteer. I don't want to call out names.
I can try.
Yes.
If I can remember well, it was a first aid class. So
Yes.
you make the patient lie down, and with the chin up, like in an angle. Then you measure some distance, but you put your hand the way like in the screen at the center, and then you kind of press until they get well or something like that, if I can remember well.
Great. That was a good trial. Any other person? Thank you so much, Kevin. Any other person? Something is forgotten.
I think you press the chest and you intermittently you also breathe through the mouth into the mouth of the patient.
Good. Thank you so much. I want us to proceed. Asante sana, John. You make sure the patient lies in a very, of course, safety first. That is D, danger. Where danger lacks, be wanting the. Nice. So ensure the safety, and then you should start by the first thing. Actually, should be able to tap the person's shoulder and shout. Just ask them, "Are you okay?" And of course, you expect some response. So you should check for breathing. How do you check for breathing? Ukieka mikono hivi, you should be able to experience that these people are breathing, without which these people may be dead. But you're not supposed to pronounce someone dead unless you're a doctor. So you place heels of one hand on the center of the chest. In this case, that should be the right. And then and the other hand on top of that one. And then you should be able to push your hands and fast, about 100 to 120 compression per minute. 100 to 120. Sasa inamaanisha ni kitu nafanya kwa mbio kidogo na inachukua a lot of energy. Then let just fully recall. I mean, ukichoka unaweza pumzika kidogo, but as you do this should be done with thorough monitoring of the patient, and the patient should get better and better as you proceed. Stop for some, maybe after 1 minute, after 40 seconds, after 1 minute, check for the patient. Are they worsening on the, and remember, as you do this, if it's a critical condition, please look look for the emergency contacts and just make sure you're able to do this. And we have a ratio. Sometimes we are forced to breathe through their, well, to apply air through their nostrils or their mouth. And so the ratio inakonga 30 to 2, 30 compressions to 2 breath. But then this is just a by the way of what I was to share today. And so when you're talking about cardiopulmonary resuscitation, then you are actually rescuing breathing. And this is a breathing support for these patients. The airways should be open. Sometimes just try to keep them engaged, and also repeat the cycle as much as possible, provided that they are getting better. And for children, the 1 year to puberty, make sure that you have the ratio of their breathing, the compressions to breathing as 15 to 2. I mean, 15 compression to 2. But for adults, 20, 30 to 2. 30 to 2. And then I think that will actually rescue breathing. And I've talked about the second thing, which is that is airway and breathing is almost the same thing. Then circulation is blood flowing well, and with the circulation, it also attacks bleeding. If someone is bleeding, you are supposed to stop the bleeding as soon as possible. These are they are actually called the philosophy of first aid to uh, for the airways and also generally. And ukishamaliza hii process, unafaa kuweka mtu in a position called recovery position. Recovery position. Let me just share a picture of how someone should, of a recovery position. Just a minute. Recovery position. Let me just share a picture of the same so that we can appreciate and we can also be very much practical in the same. I think this is the best one. After ushamaliza, unafaa kuweka mtu in this position. This should be a recovery position. Good. Good. I think you can all see that position. Any recovery position. But for the unconscious patients, try to trigger the sensitive part of their body. Ni kama wale wenye wamefaint. The sensitive parts of their body can be in the palm of their hands, or should I call them the heels? Not the heels, but katikati ya miguu. I mean, in the toe, hapo katikati tu. Just scrub it off. Just try to stimulate them. Unaweza wachuna hata kidogo so that you stimulate them. Kikata, put some sugar under the tongue and or even salt, like in salt kidogo, but sugar works best. Or put some sugar in the palm of the hands, and then they're able to actually be stimulated over time. While doing this, make sure that there's free air circulation. Okay, tight clothing, remove them immediately. And make sure that even as you do this, there's no crowd near you. There's no crowd. Mnafaa kuwa at maximum 4. In fact, wanasemanga, just be you and your assistant or 2 assistants. And that is all. That is all. Just because of safety and such. We talked about cystic fibrosis. Maxwell will talk about lung cancer in a few, so he will talk about all the type of cancers. So I will not really talk about all this because I had talked about them. Now, there are signs and symptoms that requires, wanasemanga, these are critical signs that action should be taken immediately. The first one is when someone is having high fever and confusion at the same time. and this is an indication of pneumonia and acute bronchitis. Remember, if you stop breathing for even 2 minutes, not even 2 minutes, oh yeah, about 2 minutes, you can actually die. And so, with high fever and confusion, you will relate this to acute bronchitis. Like, unajua acute bronchitis can actually kill you within hours, or pneumonia, and pneumonia, of course, within days. Um, when someone is having severe breathlessness, like they're just breathing, well, I included too much notes in my presentation so that nikiwatumia msome mwelewe what I meant. But I am actually making a summary of what is in my presentation. So there come a case where there's someone with severe breathlessness. I mean, they're not able to have a normal, rate of breathing. And this can actually be an indicator of COPD or asthma. And sometimes this can lead to death within hours. And so these are conditions that you will not even try struggling with the, ati sasa wacha iko wapi, for example, eucalyptus oil iko wapi, so that no, rush these patients to the hospital as soon as possible, waongezewe hewa, na of course wapelekwe critical care units, if that is possible. But even as we wait for this, if it's severe breathlessness, do CPR. If it is high fever, confusions, and all that, try to give them some, and try to give them some, like just increase their breathing, speed. This can be done by, of course, CPDs, but you can also do CPR. That is this one, the one we've actually been able to talk about. Now, I want us to proceed. Now, new start is the way. So hapa ndio treatment inaanzia. So that for a general respiratory wellness, someone must actually eat well. We are starting from nutrition, and specific food for the respiratory system involve protein-rich diet, which actually help in just repairing the worn-out tissues, and also is able to boost immunity. Of course, we are also referring to fruits and vegetables. Then, uh, foods rich in vitamins, omega 3, omega 3 majorly, na pia foods that are rich in antioxidants. Hapo sasa utaongeza flaxseed as one of the best. And then when you talk about temperance, then avoid vitu kama tobacco. We have alcohol. We have alcohol, tobacco, the hard drugs, and all that. Because we realize that temperance is using that which is good judiciously, and avoiding completely that which is bad, like tobacco and alcohol and the rest. And then we have fresh air. In fresh air, hapa ndio sasa kuna mambo. Most of us actually experience COPDs are developing just because we do not take a deep breath. Sasa hapo kwa fresh air, this is the secret. The deeper you breathe, the more your lung capacity enlarges. And the more you stay inactive, the narrow your lung capacity become. So spend time in clean and polluted environments and just take a deep breath, and do this at least 3 times a day. And this is actually accompanied by exercise. Do as more as possible, like as much as possible, exercises that involves the respiratory system. Mostly, ukianza kuona like uko breathless, ama sometimes unaona your breathing speed imepita kiasi, Then exercise, regular exercise strengthens the lung capacity and also promotes a general cardiovascular health. And then we have sunlight, exposure to to sunlight. Of course, we say that sunlight is not the source of vitamin D, but it stimulates the production of vitamin D. And so, sunlight plays a very crucial role in immune regulation and respiratory health in general. And then rest, adequate rest, of course, rejuvenates you and just strengthens the immune system. Rest strengthens the immune system. Sasa, anyone with any condition, the question is, how are you eating? Before you even think of drugs, how are you eating? What are you taking? This should form part of the history taking. Are you a drug addict? Are you taking tobacco, alcohol, and such,
These
cigarettes, vitu kama hizo? How do you, how do you exercise? What about sunlight? And lastly, how about trust in God? How about trust in God? So now we get into the treatment now. For every treatment of the respiratory system, this my slides are too small. Hey, okay, it's too small. I think I'll be able to enlarge it. Wait. Sijui kama mnaweza ona, but ngoja tu nizienlarge. I believe you can now see them. Are you able to see them well?
yes.
Great. Now, this is a general respiratory detox formula with the dosages in order of priority, so that mullein leaf icona a very, it's actually called an expectorant. Mullein wheat leaf is an expectorant. All expectorants are able to clear excess mucus in the lining. Remember, we have said that most of the inflammation in the respiratory tract and infections and even obstruction happens because um, well when some of the clinical representation ni kwamba kuna excess production of mucus, and so number one target is that we clear off excess mucus in this at this time. Mullein wheat, mullein leaf, thyme, eucalyptus leaf, licorice, the first four are able to do this work perfectly. Actually perfectly. Kitu nitaongeza tu hapo, the very first four, thyme, mullein leaf, sugar, what is it? Yeah, peppermint. I will add peppermint there. So about this respiratory detox for 1 kilogram, this is a 1 kilogram respiratory detox, so that mullein utaongeza 20 teaspoon, sorry, thyme 15, eucalyptus 10, licorice 10, ginger, garlic 10, turmeric 10, lemongrass 8, and also hibiscus 5. And then we have black pepper 2 and black pepper 2. Sasa hii formula si lazima ukuwe na hizi vitu zote, but just a minute. But there are things that you cannot miss. You cannot miss. Oh, someone is calling me, but I will not speak for now. What is it that you cannot miss? You cannot miss a class that is containing expectorant. Hapa, thyme, eucalyptus leaf, mullein will do very well, and even licorice zitafanya very well. You cannot miss a class that is coming handy with the antimicrobial property. And herbs that comes handy with antimicrobial property majorly zinakwanga kali. Na tunaanza na essential oils. Eucalyptus leaf, peppermint, tuko na ginger, garlic, hizo. Tuko na cayenne, by the way cayenne is a good one. Na pia tuko na golden seal. Golden seal is not in my list here, but you can add it. Herbs that are very powerful in antimicrobial property, hizo ndio nimesema. And then you should include, kama ni bronchitis for example, an inflammation, then we are including a herb that will actually reduce the inflammation and reduce pain at the same time, because several patients will now suffer from what is it, chest pains. A good example is when there's cancer of the respiratory tract, majorly the lung cancers. But other examples also include COPDs and even pneumonia. Sasa, anyone having asthma and all this, just include this formula and give them as a starter detox, and this will actually do wonders in their treatment progress. So this is the formula. You can write it, and you can also, I'll also send you the slides so that you can be able to.
Question on that.
Yes, please.
So if you get all of them, you can mix all of them.
Yeah, you can mix all of them.
But if you don't,
just look for one herb with anti-inflammatory, one herb with expectorant property. I wish, in our third module of training, we teach this in detail. So that is why I was actually just passing through.
Okay.
But I believe we are understanding what expectorants are. Nimewaelezea na nimewapea examples. And then look for a broad spectrum antibiotic ama anti-infectives ama a lighter word ni antibacterial ama antifungal hizo. So unatafuta moja yenye iko kali kabisa. One of them ni golden seal ama tuko na ginger, garlic. And then look for an expectorant, look for an anti-inflammatory, look for an immune booster. Hizo peke yake, and then you are good to go.
Okay.
Sawa Kevin.
Sawa. Hiyo ukiandika ginger root inamaanisha hiyo maji.
Inamaanisha ile ginger tu, si ile ginger yenye tunatumia inakwanga roots.
Oh, okay. Not the powder, right?
Of course the powdered roots.
Okay.
Yeah, the powdered roots. Yeah. So and please, you should not miss to include either ginger ama garlic ama cayenne, because hizo tatu, majorly ginger na cayenne, brings a heating effects to the respiratory, and this is very good because it helps to increase blood flow to that region and also help in hyperfunctioning. I mean, it will really do well in clearing bacteria na vitu kama hizo. I included it here. I thought I forgot time. Let's proceed. Bado tuko mbali kidogo kumaliza, but ndio nimeona imefika 9. You guys did not nikumbusha. Nice. Just stop recording and start again. Great. Some minute I start off again. My sessions will be recorded in two bits, so sessions will be recorded in 2 sections. Some Shanghai. I'm using an app here, which is quite tricky.
Options over here. Now, if you don't want to create a website like this, wherein you're offering different services, if you want to create a specific website, wherein you want to show.
Another question? Nice. Let's proceed. The herbs which I've not been able to mention, kama licorice. Licorice, by the way, is a very good herb. And licorice, ikitumika na rosemary, you can use it for patients with hypotension. Licorice, these are contraindications from the formula I've been able to give. When you're on hypertension and kidney failure, should not use licorice. But when you wanna, just include the licorice up. I believe it's not in my slides, but iko kwa hii nini, iko kwa hii category. Let me just get back. Iko kwa hii category ya respiratory support. Na expectorants. Oh, it's actually there. It's there. Very good. Licorice is there. Sorry, I didn't look into it well. Now, number 2, eucalyptus oil for internal use in children under 6 inaweza leta complication. One of them is hyponepia, something like that. Hyponepia. Inamaanisha these children can at some point lose focus ama lose control or something like that when they actually steam for a long time. So the secret is just steam them in an open environment, maybe with a cup or something. Then and not below 1 year old. Actually, not below 3 year old. Not below 3 year old. Hibiscus, a lighter dose for pregnancy, and generally for infants, pregnancy, and those who are on medication will just do well to have a specific, to research so that they are what is called herb interaction, or this may come with cases like, for example, those who are breastfeeding. It can bring about, it can actually affect the fetus, so that the immunity of the fetus is not ready to assimilate this herb. So ikiingia kwa fetus itakaa tu kama just a normal antigen tu yenye iko hapo. This may bring complications. So for expectorant mothers, very keen caution. Majorly watatumia more foods than herbs now. And those who are on medication, there are herbs which can actually have herb interaction or herb drug interaction. A good example is licorice. Licorice, wenye wanatumia glucomate hawafai kutumia. Na pia wenye wanakutumia hizi madawa za generally madawa za diabetes, kuna venye it will bring undesirable effect. And pia wenye wameenda for chemotherapy and all that, it can actually bring hyper what? It can actually facilitate, like, bring the body into a hyper functioning, sort of. So you be very careful while using them on such patients. Now, I want us to proceed. I want us to proceed a little bit, and I want to add you some apps that can be used for the same, which I did not include in my slides, and I will be very specific now so that we can kuna formula that you can use to make your own anti-allergic stroke asthma conditions. Actually, I made one today. And I think it's very ready for consumption. Inaitwa anti-allergen, and this one I believe you'll just be able to write. Let me also write it in the chat box. Let me also write it. Well, So I believe you are writing. So the first one is artemisia. This is a formula for wale wenye wako na asthma, na hii asthma imekuwa cause na allergy. Imekuwa cause na allergy. Notable to write. Can insert a text box. Missing some complex meaning here. We have anti-allergy formula, and we are starting with number one. Artemisia. Artemisia. I believe inaandikwa hivyo. Artemisia. Actually inaitwa Artemisia lumefantrine or something like that. But number two, we have stinging needle. Stinging needle. And then number three, we have mixed artemisia, stinging needle. There's a herb called chickweed. It's very common. There's chickweed, but that chickweed, you can stroke it, chickweed, or you can actually add echinacea there. You can add echinacea there. And then we are adding cayenne. Cayenne. And lastly, we are adding one blood tonic. I want you guys to tell me one blood tonic that you think we should add here. Any blood tonic that you know? Bardock, yes, thank you, Bardock. This one I'm looking for. Bardock is good. Dandelion. Which other one?
Garlic.
Garlic is a good one. Actually, we can add garlic. Dandelion, yes, but not for respiratory. Not that much for respiratory. Thank you. We have for, you said garlic. Yes, someone? Inaanza na why? Yes, someone was speaking. Ama nimesema inaanza na why ukazima.
Yellow.
That is a good trial. Yes, thank you, Redemptor. Yellow dog. Actually, hiyo ni formula nzuri sana ya wenye wako na asthma na wenye wako na hiyo asthma imekuwa caused by allergy. It's an allergic asthma. Now, let me tell you the functioning of this. Artemisia, yellow dog, will act greatly in clearing the allergens, and either from the blood or from without. And kama kumekuwa na antibodies against such, stinging needle will actually help. Stinging needle is a herb which is known as antihistamine. An antihistamine herb is able, kama uko na what is called hypersensitivity. Hypersensitivity inamaanisha you react very much on the allergens. I mean, on the triggers. Na jana tulisema on external stimuli like dust na vitu kama hizo. Yoyote mwenye ana react too much on such, histamine zake zinapanda. Sasa stinging needle is able to actually reduce the histamine and chickweed very much. They're able to do this. So I got all these herbs and mixed them in a ratio. Stinging needle ilikuwa mingi sana. If we are making 500 grams, ile chupa middle size, labda hii nitaweka, please write. Hii nitaweka around 5 teaspoon. And then hii nitaweka kama 3. Hii pia nitaweka around 3. Yellow dog nitaweka 3, yes. Then garlic nitaweka 1 or 2, but 1 will do. Cayenne pia nitaweka 1. Cayenne pia nitaweka 1. Singing little hata naweza weka 6 because this is actually the main app. So nikiweka hiyo 6 hii naweza weka 4. Then hii dawa itakuwa kali. Hii dawa itakuwa kali, si mchezo, lakini kama ni watoto you can do what you can do how is it called, you can do syrups, you can sweeten it, you can capsulate kama ni watoto. Hata kama ni watu wazima wenye pia wanaogopa ukali pia unaweza capsulate. You can capsulate for them. I want us to proceed. There are other treatments for respiratory diseases that have not... Yes.
What is to capsulate?
To capsulate. Wow. Yes, that is a good question. Someone kindly respond to that question.
I think you put in capsules.
Great. So that is it. You just put in capsules. Acha niwaonyeshe capsules. I think I have some capsules around. Where are those capsules? Actually, today I was capsulating some cayenne in the evening. So I want to show you how capsules look like. Mada si lazima niwaonyeshe. Mtaona. Nice. So if you look at this, zinaonekana cool. Yeah, I think you can see them. Sasa, if it's a bitter herb, you put it in such. This is made from saturated polysaccharides. Inamaanisha they are food grade capsules. So ukishaweka cayenne yako hapo ndani and then unapatia tu mtu anameza, it's able to do almost, though not fully, the same effect as if you did not capsulate. But cayenne I recommend that someone should just take. Alright. So this is a very bitter combination, but very powerful. And then, sasa mwenye ako na asthma, what would you do? Remember, there are things that you cannot miss in that treatment. Number 1 is respiratory detox, at least once a day. So if you are writing your program, include respiratory detox, include an anti-allergic or anti-allergy formula. Number 3, include exercise, deep breathing for at least 5 times in a day. Deep breathing, ile yenye wana breathe in and then they hold for some few minutes and they breathe out. And then do not forget to include but then in the detox, they can alternate it with steaming inhalation. So at some point they just detox with the formula I gave you. At some point they do steaming inhalation. And then of course diet is very key in all this. Food rich in protein. Majorly kwa wale wenye wako na pneumonia. Pneumonia inataka a lot of protein, by the way, because that bacteria is able to invade the cells. So we are replacing the worn out tissues and cells. Na hata tukiongelea cancer, well, I will not talk about cancer. But tukiongelea cancer, of course, let me just speak about it. This how we'll restrict diet, but also improve on restrict carbs, restrict carbohydrate and some fats, but also improve on protein intake. The best one is what is called a protein shake. We'll make what is called a protein shake. Protein shake. And let's proceed. There are times when someone need what is called nasal irrigation. Let me write it in the chat box. Nasal irrigation. Nasal irrigation. Nasal irrigation inafanywa na saline. Saline water ama normal saline. Majorly during infections, nasal irrigation. Yeah, good. That is the right one. So, this just involves rinsing your nasal passages with saline solution. Na hii inasaidianga ku clear allergens kwa wenye wako na asthma and also just reduce congestion. Hii this nasal irrigation can be done for anyone having asthma or any infection. It's actually a good one, and you can do it with normal saline. And then for food, this is specifically for food. You know, kuna vitu siku include, and now they are just coming. As I continue, they are just coming. So if I am really not organized in my words, you just write what comes out. Now, there are foods which are very rich anti-inflammatory in anti-inflammatory properties kama omega-3 fatty acids, na nilisema these include flax seeds and walnuts. Hizo ndio actually they are among the best. Flax seeds and what and walnuts, but you can also add the berries. Sunday, God willing, nitawaletea cranberry, muone vile inakaa. The cranberries. I know you know of the blueberries, the red raspberries, najua mnajua, lakini I'm not sure whether all of you know what cranberries are. So I'll bring it so that you can appreciate. Very good and potent herbs for the urinary tract. And by the way, next week we'll do urinary tract. I believe from Sunday. From Sunday we'll do urinary tract. Now, let me proceed. With the hydrotherapy, tulisema unaweza tumia essential oils like lavender, eucalyptus, peppermint, na nini tena? Frankincense kwa wenye wanaweza pata. Yeah, but lavender is a good one, and the ones I've been able to say. I may speak up to tomorrow and yet not address your concern. Before I proceed, let me get the questions because I can see we have the next 20 minutes to be done with this. Let me check if there are questions in the chat box. Oh, there are questions. Great. So, have we understood? I know there is a lot of content. I know there is a lot of knowledge, but this is a starter off so that while you may read after this, you're able to understand deeply. Let's hear from Melissa Mora. Is everything clear? Melissa? Je, umeelewa? Melissa ni kama ameenda kulala. Melissa ana keep the laws of health. What about Winnie Odhiambo? Yes, Melissa?
Oh, I was offline kidogo. Umeuliza swali?
I'm asking whether we are at par. Ama hata hujanipata hapo mwisho. Are we, is everything okay?
Yeah, it's okay. I wanted to ask, what about recurring tonsillitis? Hii formula itaponya?
Yote. Hiyo itamaliza yote. Within 2 days. Actually, there's a herb called croton. Sijui kama mnajua croton. Mnajua croton? Anyone who knows croton?
Yes.
Mnajua croton inaitwaje kwa Kijaluo, Pamela?
Kwa Kijaluo sijui, lakini naijua tu kwa Kizungu.
Tulikuwa tunaitumia kucheza banta tukiwa wadogo, si ni hiyo?
Yes.
Yeah, guys, you can Google what croton is. You can use the seeds at the back for tonsillitis. Yes, Redemption.
What are the spellings of that name?
Croton, C-R-O-T-O-N. The croton di something, dichotomous or di something. You can Google and see whether you can relate with it. Hiyo ni a very powerful herb for tonsillitis. But of course, hata ile boom peke yake, that flu bomb yenye tuliwapatia juzi on Sunday is a very powerful combination for tonsillitis. Tonsillitis actually ni kitu rahisi sana. You just need ni infection. So you need a powerful anti-inflammatory. Yeah. Yes.
How do you use it?
How do you use it?
Or how do you prepare it?
Well, you put 1 tablespoon of croton powder. Those should be from the leaf, the bark, or the seeds, or the leaves. You can actually mix all of them, the bark, seeds, and leaves. And then you decoct for about 10 minutes. Una boil for about 10 minutes, and then you take it 3 times a day for only 2 days, and then you are full.
Okay.
Nice. Lakini hata wenye wako na tonsils na sore throat, wenda tu chukue raw ginger and take it the way it is. Raw ginger tu peke yake and take it the way it is. Take it after every 3 hours and give me the result after 1 day. Itakuwa imeisha. Raw ginger peke yake. I don't advise you to use raw garlic, so please don't. Samuel Maina, are we? Oh well, this well. You realize when you're not, but are we together? Are we together? We're together, Ruth. This should be Ruth ama ni nani? Natumia Samuel Maina nini?
Yes, Marimi, we are together.
Oh, we are together. Nice. Redemptor, you wanted to say something?
No, I want together.
We are together. Let me get any question or any addition. I know this is just a surface presentation on all this, but this is now calling our attention to go and read more. So if you have any question you can ask, then we can close with the word of prayer.
I have another question.
Yes.
So there's a child alikuwa na recurring tonsillitis, but akatolewa before tujue hii health message. Alifanya surgery katolewa, lakini sasa akona recurring ear infection. I don't know if ENT iko anyway, hii formula bado itasaidia.
No, for ear infection, there's a tincture we always make. Yeah, Webugia ugandensis. Inaitwa Warbugia. Let me write it in the chat box. There's a very powerful inaitwa Warbugia ugandensis, something like that. Unaweza angalia online. Tincture yake itamaliza recurrent anything to do with the ear, otitis media, ama ENT ama BNT ama any other condition that is an infection to the ear. Na huyo mtoto anaweza tumia Webugia ugandensis, lakini atawahi pona kama ataendelea kutumia a lot of sugar, mostly the refined sugar. That is number one, the very first thing. And then number two is about the general hygiene. Asikuwa anashikashika nini, asikuwa anashikashika the ears. Of course, this introduces more and more pathogens. And children are very vulnerable because their immunity iko chini. Sasa for such, just target in boosting immunity. Kwanza unaweza tumia black seed oil. Hiyo ita boost immunity within days. Or you can use baobab, black seed oil, and a lot of vegetables and fruits. Alongside that, use Webuja ugandensis application in the year. And during this treatment time for like 1.5 to 2 months, situmie refined sugar, reduce animal products as much as they can, then you'll be well. You'll be well. You'll be well. Nice. There's something I actually forgot when I was talking about exercise, but this one I will give you as a takeaway assignment. When them wangale into this, there's something called pulse lip breathing. Let me write it in the chat box if I can write it. Pulse lip breathing. This is your assignment for today. It will not be marked. It will not be collected. Kwa sababu mwalimu ako lazy, but I want you guys to go and look into that. Pulse lip breathing.
Lip.
And there's also another one
breathing.
There's also another one called box breathing. I think nimeziandika hapo. Just go and have an idea of how the two are able to boost generally your respiratory health, and know how to do them. Sawa. Yeah. So I will welcome Kevin to say a word. Then I'll also find someone to pray with us even as we end.
Box breathing.